Hey Tina, it's Ryan. This is my first part A of exam 2 for the knee for lower extremity injuries. I'm going to start with Thessaly's, so Riley, you can come over here. So Thessaly's is going to be testing for meniscus, and I'm going to first have him get into a 5-degree squat with the affected leg, and I'm going to hold his hands, and he's going to internally and externally rotate his knee 3 times. And then we're going to do the same thing after this, but in 20 degrees flexion. So he's going to flex his knee a little bit more, perfect, just like that. And we're going to do 3 more times. We're going to repeat that with 20 degrees. And if there's any pain along the medial or lateral joint line, or if there's any locking or catching, then that's indicative of a positive test, and that could be or mean that it's a meniscus tear. And then next, you come over here. We're going to do a gaze test. So I'm going to first have Bradley lean up against the wall, and I'm going to have him point his toes outwards. And keeping his heels on the ground, I'm going to ask him to squat to 90 degrees slowly and come back up slowly. And this is when the feet are pointed outward, this is testing the medial meniscus. And then when the feet are inward, that's testing the lateral meniscus. And if there is, go ahead and squat for me, nice and slow, good. Keeping heels on the ground. You don't have to put your toes so far out. Perfect, right there. There we go. If there is pain, or if there's locking at that 90 degrees right before he comes up for either of these, so also with your feet in, then that could mean meniscus tear as well. So feet in is going to be lateral, and feet out is going to be medial meniscus. So next, I'm gonna have Bradley lay on the treatment table, and I'm going to do medial patellar plica test. So I'm going to go underneath here, scooch my hand underneath here. Ideally, his feet would be on the end of the treatment table, not dangling like this, but I want to have the knee in a 30-degree flexion, and I'm going to move the patella medially, and I'm going to be feeling around the area with my finger where the plica band is, and if there's increased pain, then that's indicative of plica being pinched over that femoral and patella. And next, I'm going to do another plica test, which is the Houston's plica test. So I'm going to internally rotate the tibia like so. I'm going to push the patella medially with my palm, and then I'm going to lay my hands right where that plica band is, and I'm going to flex and extend the knee like so. And if I feel any clicking or popping, or there's tenderness along that band, then that's also a positive test for plica. Next, I'm going to do Ober test. Can you get on your side for me, Bradley? This way, face that way. Yep. And I'm going to, this is going to be for IT band. So I'm going to have him, I'm gonna put his leg in a 90-degree flexion for knee flexion, and then I'm going to move the leg over this way so that the TFL is right over that GT, and I'm going to abduct as far as possible, and I'm going to drop it. And if it were to stay up in this abducted position, that would be a positive test, and that would mean IT band tightness. And then the other IT band test, if you get on your back for me, please, is called the Noble test, and that's where I'm gonna have the patient's relaxed, and I'm gonna start with a 90-degree with the knee, and I'm going to push on this lateral femoral epicondyle. I'm gonna have pressure on that, and then I'm going to extend the knee like so, and when we get to about 30 degrees and there's pain, that would be indicative of a positive test. That would mean IT band tightness.